Hi, my name is Dr. Chirag Mehta, and I'm an interventional cardiologist here in the high desert in Victorville, California. This is a very special month for us in cardiology. It is American Heart Month, February. It's a very special month because I like to specifically talk about women's heart health because it's such an under-recognized problem that we are facing here in the high desert as well as in the country itself. 1 out of every 3 women in this country will die from heart disease. That is a shocking number for us to think about, especially when we think that 1 out of every 30 women will die from breast cancer. Women often present in different ways and are often not as assessed as a lot of our male patients. Another shocking thing that is, over the last 30 years, more women have died per year from heart disease than men. And personally, we are often thinking that the reason is that women are not being seen quickly enough for a lot of the symptoms they have. So what symptoms can women have that are different from men at this point? Some of the things that patients may be noticing are fatigue, shortness of breath, chest pain, nausea, abdominal discomfort, and poor sleep. These are symptoms that we may not always think about related to our heart, and that's why it's very important, especially this month, for you to communicate with your family and to communicate with your providers about the symptoms you're experiencing. Over the last 30 years, we have been able to make very big strides in detecting heart disease and treating it. In terms of detecting, the things we're looking for are patients with significant risk factors, high blood pressure, elevated cholesterol, obesity, smoking, elevated blood sugar and diabetes, and a strong family history. More than 90% of all women in this country have at least one of those symptoms. So at this point, it is very important for us to recognize our risk factors and to try to detect what's going on with the patient. In our office, a very careful history is the most important thing first. We need to hear from our patients how they're feeling and what they're concerned about. Because so many patients are being missed for cardiac disease, specifically women, we want to be aggressive with testing, doing EKGs, ultrasounds or echocardiograms, and stress tests for further evaluation. After performing some of these diagnostic tests on our patients, this allows us to determine what's going on with the patient's heart and how we can help them. How can we prevent a heart attack or a stroke or an emergency room visit? Now there's numerous new drugs and therapies that we can do, new lifestyle changes that we can do, and even cardiac procedures that we can look into for our patients in order to have them live a longer, happier, and healthier life. So specifically for our practice, it's really important that we get a careful history for our patients, especially our women patients, to really determine what's bothering them and how they're feeling. This will allow us to determine what to do next. I also want to introduce our newest provider here in our office. This is our nurse practitioner, Shawnee. She has over 20 years of experience in working in emergency rooms and in various healthcare clinics. What's amazing about her is that she can listen to our women patients and really identify with the conditions and the symptoms that they're experiencing. Unfortunately, cardiology is a very male-dominated field, and it's really important that you do get a provider who can listen to you and can understand what you're going through, understanding your risk assessment, and determining what we can do in order to prevent future problems. I'm really excited that she's going to be here, part of our community. She's going to be a major asset to our patients, and she is very excited to start seeing our patients. She has a very strong interest in women's health in specific, as well as cardiovascular prevention. And she cannot wait to get started seeing patients here in our community who really strongly need our help and really need to be further evaluated after initially speaking with their primary care physician or even family members about how they're feeling. The last thing I'll mention is a lot of patients have no symptoms. They feel great and they say, do I need to see a cardiologist? Do I have any problems? And I think those types of patients are very unique and very important to us as well. What we can really offer to those patients is a cardiovascular tool or risk assessment. And that is basically determining how well am I doing. I think I'm doing well, but I'm not sure. We can use objective data to determine the risk factor number, and then also follow them in the future to determine, is that objective data improving? For instance, if they have a 5 to 7% risk of having a cardiac event over the next 5 years, maybe there's certain interventions that we can do that are simple, and watching them over time, determining if that risk can go down. And this is a very powerful thing that can be done in our cardiology practice in order to help prevent our patients from getting sick and getting to the hospital or having other adverse events. This is a very unique thing to my practice, which is also known as cardiovascular prevention. There's other tests that we can offer in order to better assess patients' risk factors, especially those that have no symptoms at all and may have strong family histories, for instance, of heart disease. And I'd like to thank today's Women Foundation specifically. This is a really important part in a really under-recognized situation for a lot of women. And our office specifically really wants to evaluate our patients here in the community. Being in town, recognizing on a daily basis our sick patients in the hospital, we want to help our community, specifically our women, avoid these situations, avoid cardiovascular failure and death. And I think that there's a lot that we can provide specifically. Having a nurse practitioner, Shawnee, with us, who has a really strong interest in women's health, is really going to bring a lot of energy to our community. And I cannot wait to see you guys. Thank you.